Call to order the Deschutes County Commission Board of Commissioners meeting for September 11th. Will you please join us in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I want to welcome you all. It's kind of a historic day, September 3rd. One of our commissioners is actually, if things worked out, is in Washington, D.C. today and was able to go to the memorial service at the Pentagon. Or at least that was her plan. So we'll have to hear from her how that was. I saw some of the coverage on TV this morning, but important day. Did you have a comment? Okay.
And those are the comments I was going to get to also. So hopefully Commissioner Dare is having a special event, being able to attend today, but also acknowledging September 11th. When you hear those words, it just kind of goes right to, wow, that's a moment in time.
So
Thank you.
So the first item on the agenda is citizen input for anything that's not on the agenda. If you have anything to say, there's blue forms up here, and you can come up and speak for 3 minutes. Doesn't look like we have any of that. So first item, our next item after citizen inputs, our consent agenda. Was there anything you wanted to pull or change?
Nothing to pull specifically, so I'll move approval of the consent agenda.
Okay, and I'll second that.
Well, just acknowledging there were some proposed edits that I was able to review for the minutes on the 19th.
Okay. Commissioner DeBone?
Yes.
Chair votes yes. The next item on our agenda is the annual reading of a proclamation declaring September Suicide Prevention Month. And I don't know if somebody's going to come up and join us with that. We have the wording here somewhere. Yeah, good morning. Go ahead and introduce yourself for the record and talk to us.
Good morning. My name is Whitney Schumacher. I'm the Suicide Prevention Coordinator for Deschutes County. I'd like to thank the commissioners and staff for making time on the agenda today, as this is a really important topic that we acknowledge every month, every year for Suicide Prevention Awareness Month. With me today is Leanna Lees and Mel Butterfield, and I'll describe their partnership with us in a little bit. I'd also like to acknowledge that we have suicide prevention champions and partners in the audience all across Central Oregon joining us here in person or virtually, and so I'd like to thank them for their support as well. Thank you for considering this proclamation recognizing September as National Suicide Prevention Month and for the work that is done throughout the year towards this cause. And we each just have a few words that we'd like to share with you. Suicide is an alarming and complex public health issue in that no single entity nor no single solution can solve. And this is why Deschutes County Health Services works in collaboration with the Central Oregon Suicide Prevention Alliance. Our program coordinates with the Central Oregon Suicide Prevention Alliance using the power of collective impact, meaning we all have a piece of the solution to own, and we lean on each other's strengths to carry forward a message of hope for many resources and evidence-based practices we have in our communities. We work together to ensure that we address the growing needs of our communities when it comes to preventing and responding to suicide attempts and deaths. We've done a lot in the past year and years for preventing suicide, and I'd like to share just a few highlights of what we've accomplished. The Zero Suicide Initiative by St. Charles, Mosaic Medical, and Deschutes County Health Services. The Central Oregon Youth Line, offered by Lines for Life, is expanding across Central Oregon to host peer-to-peer dialogue and youth outreach. Youth leadership is fostered through Deschutes County's Youth Action Councils, as youth are guided to help improve mental health promotion in their schools and to seek access to help through school-based health centers and other supports. The Central Oregon Health Council has brought the Friendship Line, serving older adults and adults with disabilities. Robust training occurs throughout the year through such as what is offered to our veterans through the Jefferson County Prevention Office of Best Care Treatment Services. And community awareness occurs throughout the year, such as partnering with all Deschutes County school districts. Our program right now is training all staff in all districts in evidence-based suicide prevention, intervention, and response best practices. So it's already been a very busy month. I'm also proud to be sitting with community partners that help make this work possible. And so now I'm going to pass it over to Leanna Lees, who is a local suicide prevention trainer. She is someone who volunteers tirelessly with the Central Oregon Suicide Prevention Alliance, is a representative of the St. Charles Zero Suicide Team, and is a champion for preventing suicide. After Leanna speaks, she'll turn it over to Mel Butterfield, who is the Central Oregon Regional Coordinator and Youth Line Crisis Intervention Specialist for the Oregon Youth Line, a program of Lines for Life. Mel has been hard at work expanding Oregon Youth Line services across the entire Central Oregon region and has become an integral cornerstone in our community for preventing youth suicide.
Thank you, Whitney. Good morning, commissioners and citizens of Deschutes County. Thank you for taking the time to listen to us today. My name is Leanna Lees, and I'm a nurse at St. Charles. My husband is a Bend firefighter. I'm also a mom to two awesome kids, Zach and Abby. Tragically, we lost our son, Zach, to suicide 5 years ago, and that changed the trajectory of our lives. When my son died, it was, of course, devastating for our family. But because of my training as a nurse, I also knew that we weren't alone in this, that suicide is a public health issue, and that there were people at Deschutes County Health Department working on suicide prevention. I chose to get involved to try to make as much good happen for others as possible from this personal tragedy. I was astonished that though I'd been a nurse for 20 years when Zach died, I knew so little about the worldwide problem of suicide or the signs to look for. I had missed key clues, and I knew that if I as a nurse was missing it, probably many other community members were missing things as well. I joined the Central Oregon suicide prevention efforts through Deschutes County as a community volunteer. I learned as much as I could from the fantastic people there, and I took many classes and I read as many articles as I could. I became a QPR instructor, which stands for Question, Persuade, Refer, through a grant by the St. Charles Foundation, and I've been privileged to teach several local classes in suicide prevention. I've also taught a workshop on caring for suicidal patients at the National Association of Critical Care Nurses conference for 2 years in a row now, and I've taught that same class to our local ER nurses at St. Charles. Now I'm on the planning committee at St. Charles to bring more comprehensive and evidence-based suicide prevention to the local health system. I do feel very hopeful for the future of mental health in Deschutes County. I want to tell you how proud I am of our Central Oregon Suicide Prevention Alliance. We have members on our team from many professions, local organizations, and walks of life, all dedicated to saving lives through prevention efforts. People of varied backgrounds and from mental health and health, social work, schools, police, veterans, seniors groups, nonprofits, and volunteers like me, who all come together in a coordinated and thoughtful work to bring suicide prevention to our community. When Oregon Lines for Life held their suicide prevention conference in Sun River last year, COSPO was well represented and recognized as a group that works, sharing information, resources, and ideas that were inspiring to others in the state. These efforts are admirable, but it isn't just first responders and mental health and medical professionals who need to know how to help. It's everyone in the community. I've seen firsthand that many of our citizens are concerned for their children, spouses, parents, siblings, and friends who have expressed suicidal thoughts. Stigma barriers around mental health issues need to be broken down so that people feel free to ask for help and receive help when needed. People need to know what their local resources are and how to access them. Our children need teaching about mental health and wellness and how to get help for a friend who might be in trouble. And we need people who aren't even concerned yet for family or friends to learn about prevention and resources also, because like CPR or first aid, The more people that are aware of the warning signs and things that they can do to help someone having a mental health crisis and where to get the professional help they need, the more people can be saved. And that's why our community awareness group plans events for Suicide Prevention Week, which is this week, promoting education and safe messaging and support for everyone in Deschutes County. Bless you. Please join us in our efforts. You may want to attend an event like the mindfulness education that's going to be held in Redmond tonight, or maybe you want to show support of suicide loss survivors. You could come to the candlelight vigil that will be in downtown Bend tomorrow night. Or on Saturday, you can help stomp out stigma at the fundraising event for the local chapter of NAMI, a group that provides classes and support groups for those with mental illness and their families. Please champion suicide prevention and mental health promotion, and let the people of Deschutes County know that you believe that mental health is just as important as physical health, and in fact, they're both crucial to the overall health of our community.
Thank you for having us all here this morning. My name is Mel Butterfield. I'm the Central Oregon Regional Coordinator for Youth Line, so I have the honor and privilege of working with local youth volunteers who volunteer all of their time to answer crisis call, texts, chats, and emails from youth all over the nation, sometimes globally, and in this area. As both of my wonderful, fabulous colleagues have already said, that this suicide is a public health issue, and one that crosses all boundaries. Race, religion, creed, socioeconomic status, all of those things don't matter. It will touch us in some way or another at some point in our lives. And so to be able to come up and have conversations and to have all of us acknowledge that that's an issue and remove the stigma and continue to have an open conversation about it is our ask of you. I want to say at the kind of the end of all of that, suicide obviously is a conversation that we need to have, but there's hope in that too. In the last year, Youthline has done a ton of work with our volunteers within the community in the Tri-County area. And within that, making sure visibility and awareness about resources. One, I think, is a community responsibility and individually for me. And my youth take all of that and champion it, and they go into their schools and to their families and their cousins and their siblings and all of the people that they have in their lives, and they share this resource. In just a year, our calls from this area, Deschutes County alone, has jumped 500%. That means that youth are using the resources if they know about it. And so that's also sense not to say that Lines for Life is kind of our parent company. They have a veterans crisis hotline. They also have an adult crisis line, an elderly loneliness line, and what I supervise is the youth line. So I've come with a ton of passion about the subject and excitement, though, that our community is recognizing that this is an ongoing conversation, and I appreciate all the time that you're giving us so that we can say Deschutes County is also representing that this is an important conversation to continue to have. So thank you for having all of us this morning.
Thank you.
So do you have some other people that are here with you that you wanted to acknowledge or introduce, or?
If anybody here is part of the Central Oregon Suicide Prevention Alliance, could you raise your hand?
Oh, here we go, yeah. Thank you.
Okay, thanks. Well, thanks for coming and talking to us today about your efforts and the various efforts. I think it's different than what we heard last year, so that's nice to hear about a specific thing. I think we got, somewhere last year, we got some cards or something that maybe have the Lines for Life numbers on it or something like that. That's always something we can have at our office. I know.
I'll give all of them to you.
So that kind of
Here they
thing.
come.
We're happy to make a delivery.
What's that? Yeah, so those are good. So, well, thanks a lot. Any comments you want to make, Commissioner?
So you said, yeah, wonderful and fabulous, and what I saw is great preparation and motivation to be here today. So I want to thank everybody for doing that. This is taking a moment in time. This is a very serious issue. When it happens, it is shocking to the families, the folks around, and people that have gone through it. It's opens your eyes, and rough time. So I understand that. But yeah, laying it out there, having people, so 500% uptake in activity, people are discussing that may be success. Is that a positive number from your point of view?
Absolutely.
Yeah, good. So that's kind of what I deduce too. Is like this is good. People are communicating. So yeah, thank you for bringing it here. Thank you for bringing the message and being well prepared for this today. So, and we do have our proclamation.
Yeah. So unless there's other comments. I'll go ahead and read the proclamation. It's one that we passed, I think we passed it actually last year, so it's the second year of the same proclamation. I don't know if the facts changed, but anyway, this is recognizing September as National Suicide Prevention Month. Whereas in the United States, one person dies by suicide every 13.3 minutes, with 44,193 deaths in our country during 2015. Whereas in Deschutes County, approximately 29 people die by suicide each year. White males aged 25 to 64 make up the majority of the number. Suicide rates among persons 10 to 24 years of age have increased since 2003. Each person's death by suicide intimately affects at least 6 other people, and several hundred friends and family members are forever changed by the loss. Whereas many of the people who have died by suicide never received effective behavioral health services for many reasons, including the stigma of using behavioral health treatment and the stigma associated with losing a loved one to suicide. Whereas far too many Deschutes County residents die by suicide each year. Whereas Deschutes County is dedicated to partnering with local behavioral health and health care organizations, state and local agencies, military veterans organizations, educational institutions, and the community at large to reduce the frequency of suicide attempts and deaths and the pain for those affected by suicide deaths through, 1, recognizing suicide as a significant public health problem in Deschutes County and declaring suicide prevention a countywide priority, supporting the continued development of accessible behavioral health services for all areas in our county, implementing national best practices in reducing suicide risk for people of all ages and backgrounds. 3, acknowledging that no single suicide prevention effort alone will be sufficient or appropriate for all populations or communities. And 4, encouraging initiatives based on the goals and activities contained in the National Strategy for Suicide Prevention, Zero Suicide of the National Action Alliance for Suicide Prevention, and the way forward by the Action Alliance's Suicide Attempt Survivor Task Force. Now therefore be it resolved that the Deschutes County Board of Commissioners do hereby designate the month of September 2019 and each year thereafter as Suicide Prevention Month in Deschutes County, and urge Deschutes County residents to learn how they can help, because suicide prevention is everyone's business. Dated this 12th day of September 2018 by the Deschutes County Board of Commissioners. So,
Well, and I'll move approval of the proclamation recognizing September 2019 as National Suicide Prevention Month.
I'll second that. Well, we appreciate the commentary. You know, it's interesting to me that I don't feel the same stigma anymore. It's been talked about. This has all been talked about so much that I think that's changed a lot in the last few years. And I think, you know, everybody that's been touched by suicide, whether it's a family member, a friend, or whatever, has realized how kind of sometimes they're predictable, sometimes they're not predictable, how kind of challenging it is because of that. And so so I think we all learned a lot about it. So glad to hear more about it today. So anyway,
Thank you for joining us.
thank you for joining
Calling
us.
for the vote then.
Yep. So we'll vote on the proclamation.
Yes.
Commissioner DeBone, and the chair votes yes.
There we go.
Kind of assumed that we'd pass it. Well, thank you very much for joining us.
Thank you.
So our next item today is the consideration of board signature of document number 2019-428 with Iris Telehealth. And Lori, oh, okay.
There we go.
Dr. Barry's going to present it to us. Go ahead and introduce yourself and tell us what you got.
I'm Will Berry. I'm Medical Director with Deschutes County Behavioral Health. And this is a renewal of a contract for telepsychiatry services, which are basically a way to provide specialized mental health medication management for our clients. This is something that we've depended on for several years now. We use a lot less of it now as we've built up our staff. And the long-term goal for us as a team is still to really not need it as a regular part But due to the difficulty in finding specialized psychiatric providers, it is something, and it's something used very commonly in Oregon, especially in more rural areas. We use telepsychiatry at our Courtney Clinic and also down for our Lapine service, and it is the only option we have currently to provide specialized services for children in Lapine. We do have an open position, a 1.0 FTE we've been trying to fill for about the last year now, and actually have some hopeful candidates who may be able to come in several months that I'm hopeful about. But it's renewal of that contract.
Great. So then this is a one-year contract?
Yes.
Now, and I may be wrong, but it says that the fee for service is $195 per hour for the licensed psychiatrist and $125 for the nurse practitioner. With the document, I think it's more than that. So I don't know if that just didn't get, I think the document says that it's $207 per hour and $133 per hour. So I don't know if that was just I was just going to ask about it. This is back on page 8A of it's packet number 38 in our packet. So I didn't know if you knew anything, any explanation of that.
I have to apologize. I do not have an explanation. I can follow up with Grace, our contract specialist, and figure out where the discrepancy is coming from. Thank you.
I mean, it just looked like it's been an increase from the maybe this was the last one, or.
Yeah, I'm wondering if that reflects an increase in rates from Iris, the company, but I can certainly get that confirmed.
That's the only, I didn't really have any questions about document otherwise.
Good catch.
Questions? Yeah.
So yeah, it looks like total maximum compensation contract, $215,000, and maybe those items are different than published on the page up front here, 207 and 133.
Anyway, but.
Would you agree, Dave? That it
Yeah,
looked-
there's a not to exceed of 215.
Yeah.
So this will just be how staff manages it. I suspect maybe this was the agenda request that was pulled over from the prior year and might have had the 195 and 125. I believe it's 207 and 133.
Yeah.
I think Janice is nodding her head back
But
there.
the total amount not to exceed remains the same.
Yeah, so that was right.
Acknowledging that.
And we've been able to stay under that and manage that with our current staffing.
Okay, good. Let's seek a motion in support of this.
With that acknowledgement, I'll move board signature of document number 2019-428, contract with Iris Telehealth.
And I'll second that. Any further discussion? Okay. Commissioner DeBonne?
Yes.
The chair votes yes. Thanks for
Good to see
joining
you.
us.
Thanks very much.
Our next item is consideration of board signature of document number 2019-665, an addendum to the lease between Deschutes County and J Youth Services for the juvenile building.
Morning, Commissioners. James Lewis, Property Manager for the county. Here today for an addendum to an existing lease with J for space at the county juvenile detention facility. And this addendum is essentially just adding 144 square feet, one office space to the existing 6,344 square feet that they currently lease. And if you remember back in July or end of June of this year, effective July 1st, there was a new lease with J for the existing space that they've had for the past few years. So it's my understanding this additional space for this one office is for a staff person to help them fulfill their mission, their current assistance to county juvenile facility. So it's, again, $155 additional. It brings their total lease payment per month to $7,502 for the 6,488 square feet. With that, I'd be happy to answer any questions.
Questions?
Just so this is existing available space. I bet they kind of started using it informally, and now this is the way to formalize this agreement. Or, I mean, I don't know what it really looks like on the ground. I'm just.
I don't know if they have been using it. It's my understanding they haven't been, that they've been kind of squeezing in space. Ken Hales.
Yeah,
is
so
here. Some questions on.
Just making.
In Hales Community Justice Department, in anticipation, there would be a question about the space. Actually, the two spaces that they'll be using were previously used by the district attorney's office when they housed assistant DAs out there doing juvenile stuff. They haven't done that for a while. So one space was filled, and now we had a staff person in the other one. We have another office to locate that staff person. And so the second person will be filling that adjacent space.
Oh, okay, that's interesting. Well, and space needs at the DA's office comes up because, yeah, they're asking for more resources, referring to the DA's office, different issue, but the DA's office, and they're not utilizing these other places like they have in the past. So that's good to know that we got down to that, though, and so that was a previous use of this space.
And I guess it was something we talked about in terms of the space needs of the DA, that, well, maybe we should go back to using some of those, places that were outside the courthouse, the old courthouse, but apparently didn't get done yet. So there might be other spaces we can use, but that was something we thought about in terms of meeting the DA's needs. So
So this is kind of a commitment for that biennial period, looks like, so, okay.
what percentage of the facility now is leased by JU Services? Any idea?
I can't remember the total square footage for that facility.
I can look that up, but half the detention center, well, I should say about 40%, they occupy with the 2 pods. That excludes control and intake. The detention staff, or our detention center, runs the other 2 pods. And in the rest of the space, it's just those 2 small offices.
And then the other question I had about when we set leases on these things is that, do we have a uniform formula for, I know that there's a joint benefit of having J there, and so, but do we have a uniform amount we charge, or how does that?
What has historically been done is I calculate essentially what the market value would be, what the market rate would be, I should say, for leasing space. In this being a unique space, it's kind of hard to determine. So I go kind of like with what a Class A office space would be, which is kind of at the upper level. And then historically, we've done 50% or just over 50% of what that market rate would be. And that is, again, because it's a complementary program that assists the county, but also it allows the nonprofit to apply for tax deferment or a tax waiver on property taxes they would otherwise pay for leasing that space. So it's below market rate.
Further questions?
No, and yeah, I'll move board signature of document number 2019-665, first addendum to a lease between Deschutes County and J Youth Services.
I'll second that. Commissioner DeBonne?
Yes.
And Chair votes yes.
Thank you.
Thank you.
Thank you.
Okay, so the next item is grant application to the Cambia Health Foundation. See if I can find that in my packet here.
Good morning.
Morning.
My name is Kathleen Meehan-Coop. I'm a management analyst at the DA's office, working to develop community safety and prevention programs. Today, I've submitted a request for us to be able to apply for a grant from the Cambia Foundation to help us continue the Goldilocks Clean Slate program. The primary focus of the funds that we'd be requesting for them from the Cambia Foundation is to continue the part-time staff that is currently grant funded to help us continue that program and to make improvements. We've just gone through an initial program evaluation, and we should have that final version of that evaluation in the next 2 weeks. But we've gotten some initial feedback that we're hoping to be able to use this staff, and in the addition of adding a quarter-time case manager that will help make even bigger improvements on the program.
So this is a program you've applied to in the past?
So not to the Cambia Foundation. So the program was initially funded through the John T. and Catherine D. MacArthur Foundation Safety and Justice Challenge. They gave us funding initially to get the program up and running, so we had a planning grant with an initial kind of pilot study funding that lasted about 18 months. Then we received funding from the Central Oregon Independent Practice Association that has funded us for the last 18 months. And we also got some additional funding back from the MacArthur Foundation to do the evaluation piece. So we are reaching out now to the Cambia Health Foundation and probably to some other foundations just to ensure that we have funding to continue the program for at least another couple of years as we really have enough of a group of participants and have a big enough number to prove whether or not this initiative is successful. Our evaluation right now shows that we're trending in a very positive direction, but our sample size is pretty small. And so we need to have more people involved in the program and the program running a longer period of time to really be able to prove whether or not it's impactful. Participants have to participate a full year. So when we ran this evaluation in May, the program had been going on for 18 months, but we only have about 6 months worth of graduates. So we're looking for funding to continue the staffing, as well as I'll be looking over the next couple months and for additional funding to do another evaluation, probably in about another 18 months from now.
What is the Cambia Foundation? I've never heard of it.
They primarily focus on health issues. They are kind of a Pacific Northwest sort of regional. They go all the way into Idaho. And they are really looking at the connection between social service programs as well as public actual physical health. So that connection between the medical world and other programs that are going on. So we feel that we're a really good fit. We reached out to them last year, and they were very interested in our proposal. Like many foundations, they got way more than applications than they could actually fund, and they requested that we resubmit the following year. They made a slight change in their the process and what they're actually looking for this year. I still think we're a good fit, and so we're applying for one of their organizing grants, which is one of their smaller grants that looks at taking kind of coordinated care, which we do with the Clean Slate program by taking people out of the criminal justice system and getting them medical care, but looking how we can expand that and make it more impactful by doing coordination of care with an additional person to kind of manage, providing like warm handoffs to helping them get to their medical appointments. Also, a lot of our program participants have issues with transportation, housing, employment, and so having a staff member to kind of help with connecting them to the social services programs that already exist. So we're looking to develop our partnerships with a lot of the nonprofits that are already existing here in Deschutes County and making those connections and helping our program participants make those connections so that they're more likely to be successful in Clean Slate.
So as I understand what you're saying, that we've been running this program for 18 months. It takes a year to go through the program, so we have 6 months of kind of how's it going. Another year or two of will be helpful probably to
Yes.
see what the benefits are. Okay, good.
And so this particular funding, it won't cover an additional evaluation, but it will help us cover the staffing for an additional 18 months.
I'm in support of you continuing it. I'm interested to see what the results are as you get further in, and
We look forward to sharing at least our initial evaluation with you as soon as that is complete, so.
any questions?
Well, and just acknowledging, having a grant application come to the board is kind of the fiscal piece of, when we ask somebody for money and they give us money and then they're referring to the whole organization and documenting that the money we received, the grant requirements were met, the grant was closed out appropriately, so that's part of what we're doing here too, on top of the program. So just acknowledging that, yeah, so. Good, well, with that, I'll move support of grant application for Cambia Health Foundation in support of the Goldilocks program in the DA's office.
Yeah, I'll second that. Commissioner DeBonne?
Yes.
And chair votes yes. Thank you.
Thank you very much, appreciate your time today.
Thank you. So my agenda shows that item number 11 was pulled, is that correct?
That is correct.
Okay. For redrafting or?
There was a miscommunication between CDD staff and legal, and so the document that came forward hadn't been through legal for review.
Okay. Well, I thought it was looking close, so if you want my 2 bits, it looks like it's close to what we need. We're going to consider that next week then at our meeting? Is that the? I think that's our plan, okay. So I guess the final item on, before a lunch recess is consideration of board signature, document number 2019-709, which is the collective bargaining agreement with Deschutes County Sheriff. It looks like we're presenting this to ourselves. So I'll say a few words about it, and then others may too. I was happy we were able to get the 3-year agreement with the Deschutes County Sheriff's Employees Association. I thought it was interesting as we learned that there's kind of an interrelatedness between what, one union group is doing with, in salaries and benefits, and how we had to, we kind of modified some of the terms within the sheriff's office. It should be noted that we increased the salaries for corrections nurses, office assistants, and mechanics, as well as some specialist things, but then also did do an increase on the sworn personnel, the detectives, corrections officers, et cetera, and added a step. So I was glad we were able to get it done. We worked with the sheriff's office a lot on that, and trying to get the final terms done. I think we had a lot of responsiveness, so I was happy about that.
So this is, July 1st, 2019, so a couple months into the agreement period.
Yeah.
But it's, it's good. It's coming to a closure here. This just showed up on our agenda from my point of view, and I was able to look at it. I'm not opposed to anything here. I'd like more maybe of a relationship with somebody, the sheriff's office representation, the association. I'm kind of surprised we're here with just you and I discussing this.
Well, I guess they'd be asking us for just an approval of it at this point. I mean, we can bring it back next Wednesday. We are a couple months into it. I guess that's better than the last time.
As I
which
say,
was a
I'm
year.
generally not opposed to it. We have, discussed it multiple times in executive session in preparation for this. But, the notification that the association has approved it was just in this documentation from my point of view. I mean, I just don't feel like there was a lot of communication on this closure part. I guess I'm kind of asking you, did you have any other information here, or?
No, I got it in my packet also.
Neither one of us
But
did, yeah.
It doesn't surprise me because I think there might have been, we'd been so involved and had so many meetings to discuss the actual terms. I think that once it was done, it was turned in. But do you know, Tom?
Commissioners, we were notified that the vote had been taken, that it had been ratified by union after it happened, so we didn't have advance knowledge of that either. Sheriff's Office did provide an executive summary of what's in the agreement, which was helpful, but I don't have an explanation on why they aren't present today.
Well, and I say this in light of long, very business-like atmosphere for represented groups in Deschutes County, multiple represented groups. We want to be very business-like, acknowledge that there's two parties. We, negotiated in a very, positive environment, and we got to the conclusion. It's like it's almost a celebration that we're missing here is what I'm seeing. Yeah.
I thought I read the executive summary, and I thought it hit some of the key parts to what was different than the previous contract, which there was only a few parts really, really the Janus decision and, a few other, the salary and step issues. So I guess I didn't have any questions. If you want to have them come back and make it.
I'm already making my public statement. So there's, as I say, it's not even a downside. It's just that we're missing an opportunity for the upside, I guess, is what I'm saying here.
Well, I am celebrating it.
Yeah, there you go.
I hope you will too. I think it's good that we, and Kathleen's joined us, who was involved also, Human Resources. I thought it was positive that we did get it done, and we got it done within a couple of months of the deadline, which I think 3 years ago had been, I don't know, almost a year or something into it before it was resolved. So that seems like positive leadership from both the union side and the Sheriff's Association and our involvement. We were involved. People don't realize sometimes how involved the commissioners and administration can be in this, but we were, so.
Well, and yeah, this is a document with Deschutes County proper for a collective bargaining unit referring to the Sheriff's Association. Sheriff's Office has been the lead in these negotiations. Professional staff has really helped us get through this point. So as I say, let's acknowledge all the great work that's gone into this, and we're putting it to bed for a 3-year period.
Let's take a motion in favor of adopting this.
Yeah, without any other input, yeah, let's get there. So I'll move approval of our board signature of document number 2019-709, collective bargaining agreement with the Deschutes County Sheriff Employee Association.
I'll second that. Any further comments? Okay, Commissioner DeBonne?
Yes.
The chair votes yes. Thank you.
I said my piece.
Okay, that looks like the completion of our morning agenda. Did we have anything this afternoon that we needed to come back for? Or?
No, Commissioners, we don't have any executive sessions scheduled. I don't know if you you're welcome to do Commissioner updates, since we don't have another meeting this week. I had just one other item, very minor, quick item.
Okay. You want to do Commissioner updates?
Sure, just kind of from memory, I did take a trip to Salem. Monday was Association of Oregon Counties. I attended federal lands, and then land use and economic development committee meetings, and the legislative meeting, and the board meeting, and the recruiting meeting for the director. I guess working my way backwards to recruiting, so Mike Eliason has announced that he does not going to apply for the director position, but that doesn't mean he's leaving the organization, so he's a legislative director, remember. So that means it's no incumbent in that position recruitment at this point. So we've got a schedule laid out. So this is the Association of Oregon Counties, just for the public, for the recruitment process, and there'll be either one or multiple candidates at AOC's November meeting, depending how it flows, and that'll be the board. So this is a committee of the board, and it'll be in coordination with the board to get to the November annual meeting of AOC.
We have one more AOC meeting.
October.
Yeah.
Yeah. So the dates are pretty much set for how that committee's going to work out. I do have some other notes about the committee meetings. Maybe I'll prepare that for a future meeting. I was able to attend a meeting yesterday, the State Interoperability Executive Council, SIEC. And this being September 11th, this is where this really got legs 18 years ago, referring to interoperability. So a sheriff's office or police station has an operable radio system, but we want that to be interoperable with somebody else's radio system or communication system. So not just audio, but other ways. The 9/11 event in New York City really brought that to the forefront. Federal government empowered efforts across the country. FirstNet is this digital system that connects multiple systems together. So that was a meeting I went to yesterday also. I had offered to bring it to AOC November conference, in fact. So I may be leading a session about interoperability of public safety communication systems around the state and just the status of the Oregon efforts on that. Also, I was able to meet with Jason Miner, the governor's environment policy person, and I mentioned to him the ADUs, Senate Bill 88, how it kind of bumped down the process and got stopped, and then also how it might balance with if there's a carbon bill discussion going to happen in the next short legislative session, how it might take the air out of the room for other issues again. So it was just an effort to kind of reach out to someone.
You have item?
Commissioners, as you know, we postponed our joint meetings this month with Sisters in Redmond due to very busy commissioner schedules this month. So I believe Sharon has put some new dates on your calendar in October and November. So I'd encourage you to kind of take a look at that. There is some work that at the staff level to prepare the agendas and put those for. So if we can lock in those dates, that would be great. If you prefer to space them out a little bit more, we're happy to do that also. But Just wanted to, and we'll send you a summary list of the 3 joint meeting dates. That would be with Lapine also, Lapine Sisters in Redmond. You've also been invited to a couple presentations. One to, I think, Redmond Kiwanis and Bend Rotary I think we've tentatively put on your schedule. So be a busy fall again, also with AOC conference in the middle of November. So just a little planning items to hopefully we'll get on a schedule. But again, if we want to space those out or postpone, we're happy to do that also.
Okay. I know there was a couple things on the agenda last week that I didn't attend that we probably are added to next week's meeting. Eastern Oregon Counties Association, a couple other things we were discussing, so I assume those we'll have a busy week busy next Wednesday, it seems like. So,
full agenda.
and then I also want to discuss the legislative things coming out of AOC. What are they?
Yeah, so I've got more
planning to
notes on
do?
some of that.
So maybe we could talk about that next Wednesday too. So, good. Okay, anything else further for the good of the order? All right, so we'll adjourn the meeting. Thank you.